The U.S. Healthcare System by Lesley Cantorna. The practice of medicine started in the early 1700s. It was a time of the heroic medicine because they used herbal remedies for the treatments of bleeding, purging, and blisters. The Marine Hospital was the first medical organization built in the late 1700s and also the first publicly funded, prepaid health insurance programs in the U.S. history. Many soldiers, pilots, and locals were treated here. The 1800s was during the American Civil War. This was the time they were free to make up medicine, enforce sanitation to reduce the spread of diseases, and increase control. The AMA was also implemented. It was a group that provided the physicians with medical education. Anesthesia was also developed for surgical and invasive procedures at this time. The hardship of the Great Depression opened up many developments in history. One, for example, the public health services. This is a group of people that brought ideas to eliminate epidemic diseases such as bacteriology, isolation, and disinfection. Health insurances to benefit employees based on health plans and group policies used for accident injuries were also developed. Disease-focused medicine was primarily for cancer research. Social Security pensions was developed. CDC, the Center for Disease and Control Prevention, was an organization that identified disease and ways to prevent it. Drugs discovered that changed our healthcare were morphine, aspirin, insulin, penicillin, etc. And the biggest improvement in our healthcare system today, the Joint Commission on Accreditation. It's a group of trustees who evaluate our healthcare facilities to establish accreditation standards to our hospitals. The mid-century developed many improvements to provide coverage to seniors. Medicare and Medicaid were created to improve healthcare to the elderly and also the poor, who had limited access to medical care. HMO also provided grants to these who had access to employee-based insurance. Technology improvements in the healthcare system caused an increase in healthcare cost. In this period, the healthcare system started becoming more of a corporate care, which government redirected policies towards private funding institutions. Hospitals were becoming part of a larger network of healthcare stakeholders. Capitation payments became more flexible with providers and accepting fixed payments on a list of services. The Omnibus Budget and Reconciliation Act developed regulations on policies and procedures with the level of care for patients with Medicare or Medicaid who were living in nursing homes. Prescription Drug User Fee Act was passed in the late 1980s due to the avian AIDS virus. This act was developed for the FDA to collect fees from the pharmaceutical companies due to the cost of the drug testing, research, and development. The Health Insurance Portability and Accountability Act was passed in 1996. The primary goal was to protect patients' healthcare information as well as employees. CHIP is the largest expansion of the taxpayers-funded health insurance coverage for children in the U.S. Taxes on cigarettes were used to fund this program. Stakeholders and their roles. Providers. Providers are those who view quality in a technical sense in healthcare. Payers focus on cost effectiveness. Employers are those who manage the frontline staff. Patients are what keep the business going. There are options that assist in healthcare costs, such as the reimbursement methods. There are different plans that are available to choose that will fit a person's lifestyle. Reimbursement method are insurance that pays a percentage of your healthcare service. Managed care organizations, also known as HMOs, covers all healthcare services that are provided but left with a deduction that the patient is responsible for. Medicare and Medicaid are government funded that covers the elderly and those who are limited to healthcare access. As the debt in our country increases, the funds for Medicare and Medicaid decreases. Private insurances are those such as Blue Cross or Blue Shield that offer coverage but at a more higher cost. As technology advances, healthcare cost increases. EHR or electronic health records is the easiest and fastest way to access patients' previous medical records. Also, patients can have access to view any results at home if needed to. The healthcare industry is becoming more aware of the benefits available with digital imaging. The advantage of such timely access to the results of diagnostic procedures. Access to images are also useful to physicians in different clinical settings. Any facility with the PACS system are able to access patients' images. A picture archiving and communication system data is a computer network designed to transfer, store, and retrieve digital medical images anywhere. Delivery of care is now available for the convenience of our patients who have no access to transportation. Care such as mobile radiography, labs, or even basic care can now be provided at the doorstep of a patient's home. Now let's talk about healthcare systems around the world, and one, for example, the Philippines. Access to healthcare services in the Philippines are private hospitals, public hospitals, and barangay health centers, which are also known as village doctors. In 2001, there were about 1,700 hospitals and healthcares in the Philippines. 40% were government funded and 60% were private funded. The people in the province mostly seek private health providers for natural health burdens such as diarrhea, bronchitis, or even the flu. The costs in the PI versus the US. US healthcare is about $8,200 per capita more compared to the Philippines, whereas $4,300 per capita is of government spending, with a percentage of 14% of that is healthcare spending. However, 17.8% private spending, or out of the pocket, is more for the people of the Philippines. In summary, U.S. spends more money on healthcare treatment with the assistance of government and insurance funding, and the people of the Philippines have little funding assistance from their government and are paying 17.8% more out of pocket. The pros of their healthcare system in the PI is that they are provided with excellent healthcare service by well-trained physicians at a cheaper rate than any other countries. However, the cons are that the availability for healthcare facility is very limited. The treatments may be cheap for us, but more expensive for the locals considering the little money they have. Most of their healthcare organizations carry poor equipment and older facilities, limiting the services provided. Moving on to reforms and improvements, the future of our healthcare system. Some changes in the Medicare were made to improve care for seniors and their families. Improvements made in preventative services now provides care without a copay for immunizations, cancer screening, and colonoscopies. However, drug coverage will only require copayments for brand prescriptions. According to Milliman USA Health Cost Index, it has estimated that per capita healthcare costs for payer will increase about 44%. Employers who pay high premiums will face staggering cost increase, whereas small employers, many already struggle to provide benefits, may drop coverage due to the increase. Government may impact the funding coverage for employees, Medicare and Medicaid beneficiaries due to the increase of healthcare costs. In conclusion, we have come a long way in our healthcare system, and I believe that in the next 10 years, we will still advance in technology to improve healthcare services and treatments, which in that case will or may result in doubling in healthcare costs. So that sums up my final presentation, and thank you for your time.